we've taken the benefits of computer navigation, but taken all the guesswork out of the time in the operating room. In other words, while you're under anesthesia, we'd like that procedure to move as quickly and smoothly as possible without having to keep you under anesthesia longer, have additional bleeding or time open of your wound open to the air. The newest system now is based on MRI scan. So what will happen is you'll have your MRI, the computer will make its suggestions, the surgeon will look at that computer model weeks ahead of your surgery, and will actually have a three-dimensional model on the computer screen of your knee with all its little bumps and nooks and crannies. And then we might make some adjustments to the computer's suggestions, like maybe increase the size of the component, turn it slightly left, turn it slightly right, and then sign off on it. Then that computer model will go back to the factory and they'll make this cutting jig. In the traditional instruments, we would make our cutting jig and then adjust and fiddle-faddle and make sure it was fitting right. We don't have to do that. We can make a smaller incision and then just like a piece of a puzzle, get it to fit just right. It's just like a jigsaw puzzle in your grandma's coffee table. And then we fill these holes with the screws, take these two screws out, and now we're left with our two screws right where they need to be. We go ahead right away, put our cutting block on, and the surgery is taking place. Really, anyone who wants a knee replacement is a candidate. As far as the MRI process, those patients that have a pacemaker or are extremely claustrophobic, which are actually pretty rare, can still do it with the CT scanner. Less cuts in the soft tissue, the patient's recovery should theoretically be smoother and quicker with a return to more normal walking sooner than the traditional methods. The more we have to cut, the more has to heal, including the marrow, including the tendon or muscle, depending on the surgeon's choice of approach. But the less we have to cut, the less has to heal, and the more the patient feels normal or better sooner.